Welcome all to our Healthy Town Culpepper. Good morning to both our panelists and our audience. My name is Dee Dee McClure, and I'm a Senior Program Officer at Northern Piedmont Community Foundation. Our particular footprint covers 4 counties, Culpepper, Fauquier, Madison, and Rappahannock in the Virginia Piedmont. We are considered the gateway to the Shenandoahs. And among the many roles our foundation plays is that of grant maker. And as such, we are always on the lookout for projects that carry long-term positive outcomes for the health of the communities we serve. Culpepper is an agricultural area. We deal with rural health challenges and challenges of health disparities. We've convened 4 panelists today to talk about Culpepper County, and how we in fact arrive at a healthy town Culpepper. The idea specifically is to understand the health risks and then develop solutions to mitigate those risks. There are indeed health risks here. And with that in mind, I want to direct our first question to Eugene Triplett. Mr. Triplett is a 4th generation farmer here. He's also sustained a lifelong career as a pharmacist. He claims he's retired. I don't believe it, as he works tirelessly for our community. And Eugene, be it urban or rural, in fact, healthy foods are key to sustaining healthy communities. How are the health and medical sectors establishing and partnering with the farmers, producers, and agricultural institutions to mitigate the health crisis here?
Well, looking back on the pandemic that we're currently going through, I think that's raised the awareness that the health community and the farming and agriculture community have had to deal with the problems of food shortages and all like that. I think in the past, the health community has not partnered a lot with the agricultural community as far as mitigating health issues. As you said, I've been a pharmacist for over 40 years, and basically I've benefited from unhealthy lifestyles and people not eating healthy. I basically made my living selling pills to treat diabetes rather than trying to prevent diabetes. And so I think now there's been a focus more on preventative health and then treating health. And it's like I said earlier to someone, not calling a name, but it was the old adage with the Fram oil filter. It said, you can pay me now, pay me later. So do you want to sell the $12 Fram oil filter? Do you want to pay for the $1,200 engine repair? And so I think now the health industry and the farming industry is basically talking to each other and saying, what can we do to mitigate this health crisis that we're having right now?
How do you go about making those relationships?
Well, I think there's a good relationship, and like I said, I'm here representing not only the health industry as a pharmacist, but also I tell everybody I'm a farming pharmacist, and so farming has been my passion all my life, but the relationships that we're forming now, I think people are looking at health in a whole different light. Like I said, I think the pandemic has raised a lot of issues that we're seeing how important healthy foods and healthy lifestyles play in our healthcare system. Like I said, I always said if we got everybody healthy and cured all the diseases, Novant Health and all of the other health systems would be out of business and we wouldn't have to do anything. But I think there's a great partnership developing now, and I think we need to increase this partnership.
So Tammy McGrath, you're on the health side. You spent almost 4 decades as a nurse. You now are the executive director of the Culpepper Free Clinic. You are part of our solution, certainly. The Free Clinic certainly is an extraordinary organization. And I'm curious because tell us about your garden project?
So I also benefit from Eugene's retirement and that he volunteers at our free clinic. And when I started there, February of 2020, we had these humongous shrubs in front of the building, and they were horrible, and we had them cut down. But then we had a lot of discussions about what to do with the space, and someone had the brilliant idea of make them into gardens. And so we had already been benefiting our patients from the minority and veterans farmers of the Piedmont would bring us some produce when they could. And we thought, well, this is a good way for our patients to kind of get in the mindset of healthy eating and healthy vegetables and how easy it is to grow them. So we had a project set up with the minority and veterans farmers of the Piedmont and Virginia Tech, and we had an educational session open to the community where we had these 4x8 garden boxes built in front of the clinic. And they videotaped it as an education session, and we started planting in them, and we planted tomatoes and peppers and zucchini, and we really got a lot of vegetables out of there. And we made the most of it by having our nutritionists keep recipes that were in line with whatever was harvesting at that moment. And it's been great. Patients love it. They come in, and I have this Pavlovian reaction because we have these little plastic bags sitting on a big table of vegetables. And I'm in my office, and when I hear those plastic bags start rustling, I start like getting this happy feeling, like, you know, when your dog hears you opening the can opener, like, but it's just, you know, they're really enjoying it, and they're taking the vegetables, and we're trying to make the most, again, of looking at ways to prevent by saying, now, what do you do with them? And can you grow them? And, you know, how can we use these instead of canned vegetables, or can we freeze these? So we've been doing a lot with that and making the most of it.
Oh, that's terrific. Is it volunteers that manage the project, or?
Yeah, we have another retired person who was actually a nutritionist with the Virginia Tech Cooperative Extension, and she and her husband have managed a great deal of that garden. And we also have involved some of the participants in Options, a local program for youths at risk. And even some of our patients and some of our just regular volunteers get out there and do everything from weed to harvest to, you know, keep the tables set up with the produce. So, yeah.
Yeah, so it takes a full circle to find your way to preventative health.
Mm-hmm.
Cam, you're on the health care side as well as the Director of Community and Diversity, Inclusion and Equity Engagement, UVA Community Health. Tell me some of the ways that you engage on the health side, how you engage with community to promote health and healing and treatment.
Yeah, happy to share, and to build on what Eugene had shared about, you know, putting us out of business. Yeah, that's the space that I work in is really trying to keep people out of the hospital, right, with that preventative work. So we really focus on engagement that facilitates authentic connections and address health needs, and that's through partnerships. That's partnering with organizations and individuals such as this panel within the community. And I guess I would start with saying, you know, our goal as a health and wellness organization is really to improve the health of the individuals in the communities that we serve, and that's promoting health and healing and treatment. And we know this from our community health needs assessments, and what our community has already shared with us are the greatest health needs. So we have outlined specific objectives that we're seeking to achieve through our partnerships and relationships with others in the community. And it's really inclusive of increasing access to healthcare services and programs. And that includes everything from transportation to medication assistance, connection to programs, promoting healthy behaviors, and a lot of it is through education as well. Education through awareness of risk factors, linking individuals and getting them connected to resources. And that's everything focused on chronic disease such as cancer. So that chronic disease management and prevention, cancer, as I mentioned, mental health and substance use disorder. And we know that health also starts in our communities, so supporting safe and healthy neighborhoods, again, access to healthy food and food security. And we do these efforts really by participating and engaging with our communities. So this is everything from health fairs to health education, health screenings, collaborative events, immunizations, and really looking at kind of targeted care navigation. And a few examples, if you allow me the time. So an example of an annual event that we host in partnership with a community business in Culpepper, Pepperberries, is called Pamper Me Pink. And so that's just one example. And the event was really designed to celebrate women's health, breast health, and promote awareness. And so through the event, through the partnership open to the community, we are encouraging screening mammograms. We're also taking the opportunity to explain exams and procedures that, may be scary to some individuals, right? The unknown. So we bring in our subject matter experts to really, have conversation and explain exams like what is a breast MRI, or what is lymphedema. And through that channel and that partnership, through that event and community building as well, is really sharing some recommendations as well. So most recently, with our recent Pamper Me Pink, we shared a yoga video and how there are health benefits to yoga, either as a current patient or a cancer patient in their journey or transitioned into survivorship, but really to talk about some of the different ways and recommendations. Trying to think of something else. Our food services team at the hospital shared a recipe for healthy smoothies, so filled with antioxidants. And then most importantly, sharing of personal stories. So in the community, really sharing stories of individuals to promote hope and healing and support and strength.
That's terrific. Chris Forston, you are a trainer, Divergent Performance, and you're well-versed in healthy living, and you also have, Chris, the opportunity to work one-on-one with people. As Kim was mentioning, some of these are, this is personal. This is, it's one person, two people make a community. So tell me what you do on a daily basis to work with your folks to make sure that they maintain health.
Yes, and what an awesome opportunity I have now, really sort of being the front line of the health, force, if you will. So we have, and we've talked a little bit about, some of the pharmaceutical stuff with Eugene. We talked about, the healthcare system, the hospitals, but as far as preventative, care goes in my realm, there's not that I didn't have purpose before, but man, what a purpose we have now, post pandemic here, and becoming a little bit more of an educator myself, becoming more well-versed and being motivated to get down to more of the nitty-gritty details of the ins and outs of why, sleep is so important, why hydration is so important, why nutrition is so important, why, we see people an hour at a time, but the conversation is really turning toward what happens the other 23 hours of the day. And that's so crucial and so important in people understanding. I think a lot of times people, used to come to, the health and, fitness industry, and, they come for an hour at a time, and it's almost like, their workout gives them an out, of sorts. And while that may be, true to some degree, it's really not the approach that we want, everyone to take. So really making sure that everyone understands that, your workout itself, the hour that you spend in here, is greatly affected by the other 23 hours. If you don't sleep well, your body's not going to respond well in the workout. If you aren't fueled properly, your body's not going to respond well. If you're not hydrated, your body's not going to respond well. And, we talk about, overall risk mitigation and these strategies to develop, healthier communities and healthier people. And the better job that I feel like I can do from that personal standpoint, and reaching people and having those discussions, I hope there's a little bit of a domino effect that takes place, and, that they can communicate with their family members. They can start installing a lot of these adjustments and new habits that, I'm talking about with them as individuals. And, we start talking about making small adjustments. If you drink a lot of poor fluids, if it's, sodas and high sugary, drinks, then we're going to start talking about how to cut some of that stuff down, adding water to the equation. And, like I said, just making those small adjustments at a time. And if we can really, educate people on how to make those small adjustments, and that's really one of my big missions coming out of this situation. I think we're going to have some fantastic outcomes, down the road.
Yep, I think so. It's prevention seems to be the word that I'm hearing again and again from all of our panelists, and that's far-reaching. I'm gonna turn the attention to cancer. Cancer is unusually prevalent here in Culpeper. We have a high incidence of cancer here. And Eugene, I'm going to come back to you. What strategies, what tactics are you implementing through your volunteer work, for instance, to stress the importance of building that healthy community in order to, in the hope of preventing an illness that can really ravage a community like cancer?
Well, as we're talking about cancer right now, and we talk about education and awareness, I think one of the things we have to do is we have to educate the public that we do have a problem. You can't treat something if you're not aware that there's a problem. And so I think as far as, we need to let the community know that, hey, Culpepper has a high incidence of cancer. We have, a problem here. And then once people are aware of a problem, then they're a little more apt to want to find a solution to the problem. One of the things I've found out, and I've tried to do this for about 5 years and it hasn't worked, but Madison County, I think in the African American population, has one of the highest incidents of prostate cancer. And my solution to that at one time is with me, and I know we were just talking about Pamper Me Pink as far as women, getting that annual mammogram and all like that. African American men, when you tell them we need to go have a prostate exam, they cringe, and that it's the old adage of the finger, and they're not aware of the blood tests. And so one of the things I've always said, African American men go to the barbershop once a month. I mean, that's what we do. And if somehow we could have a PSA test administered in barbershops, I think we would get a lot of African American men diagnosed before they realize they have prostate cancer. But it's an education and awareness, and you have to be aware of a problem before you can find a solution. And most people aren't aware that they have a problem. And so I think one of the things we've done with the free clinic, we've had educational, like I said, with the nutritionists coming in, especially with healthy eating. A lot of people don't know how to cook healthy foods. They don't know how to, new foods that are out there that are healthy for them. So once you educate them, A prime example I can list is we had at the Carver Center, let's say last year we donated over 9,000 pounds of produce from the Carver Center to local food banks. But at one time we had so much zucchini that we didn't know what to do with it, but we took it up to Rappahannock, and one of the chefs up there started cooking zucchini lasagna. And they cooked a lot of zucchini lasagna, and they gave it to a lot of families up there on a Saturday. And then all of a sudden, people said, "Man, this is good. I never know you could make, lasagna from zucchini." And so now people had another. And so that's education and awareness. That's what you have to do to let people know. And as Chris said, we only see people for 1 or 2 hours. That's what, it's what they do the other 20, 24 to 23 to 22 hours of a day that really impacts their health. And so we have to educate people and make them aware that hydrate, sleep well, and all of these preventative things will help.
Tammy, what do you see at the free clinic in terms of cancer patients, and also a reluctance to seek medical treatment? Do you face some of those challenges?
Yeah, absolutely. In fact, one of the things that we come up against right from the start is that some of our patients, not only have they maybe not gone to a doctor in a long time, some of them have literally never been to a doctor. Some of our patients who are coming in who are from Central America and recently arrived, they have never been to a doctor, and definitely never been to a doctor here in this country. I apologize for that phone. So what we come up against right away is that, and then trying to show the importance of looking at their lives and looking at what they're doing and what they could do differently. They really have no idea that maybe there's healthier ways to do things. And then do they want to? Do they want to change how they've been doing things their whole lives and their families before them? And that's how they were taught. So it is a big challenge, and compliance is a huge challenge. We have really have to, explain, teach to try and get people to do the things to get ahead of illness. And so it is a challenge for us, absolutely.
So I'm going to shift a little bit here. These are, all of you told some very personal stories in terms of working one-on-one with people, in terms of how you approach community. Kim, you have a way in which to use data to inform strategies and decisions, and I'm curious about what UVA Community Health does in terms of their use of data to inform.
Yeah, so utilizing data to understand community needs really gives strategic direction to the work that we lead, and it's varying data points. So we use public health data, obviously data that we see from the hospitals, the community health needs assessments, and that really guides our work. So the hospital conducts a community health needs assessment every 3 years, and that's a collaborative approach that we work with many partners, such as the panel here today, and key stakeholders in the community to really survey and ask the community, what are the greatest needs? What are your greatest concerns and health concerns? And then we take that information and with the help of partners, really look at building out a plan and solutions. So the strategies, they vary, and it depends really with what the specific problems are that are being addressed, and the community demographics. So, what are those patient populations, or where are the specific geographies, like Eugene mentioned, seeing high incidence of prostate cancer in Madison. And we take all of that information, and that informs basically our strategy with our partners on the solutions on where we should go. So more education in specific geographies or communities or neighborhoods.
I would like to turn the attention now a little bit from present day to the future. And Chris, in the work that you do, how do you do future planning? I mean, how taking what you know now and understanding how you work one-on-one with people, how do you think about down the road and what to bring your folks down the road?
Well, I mean, I think it starts with, short-term goals versus long-term goals. We're talking about short-term strategies, how we're going to, lay the foundation for starting to produce some good outcomes and starting to feel good. And then, understanding how those short-term goals, the small adjustments play a much larger role in the long term. And, one of the great things about, making adjustments in your life is that they can be done at any time, and then they're going to have a positive outcome. So whether you're, 30 years old and, you haven't lived the healthiest life, or maybe you have, and you just need to continue that, or you're, 65 and, things just, you didn't really have a focus on your health. There's no time in one's life where you can't start making these adjustments and they're going to have, positive outcomes. So wherever you're starting, it's so important to understand that it's never too late to find, what you need in your life to, get moving and get healthy and understand all the positive benefits that are to come when you surround yourself with those habits and how those habits, play off on the people around you. So, we're talking a little bit about the hour that I see people, in the building, but, I'm also encouraging, these folks, like we said, these other 23 hours of the day, do you love to dance? Do you love hiking? Do you love nature? Do you love swimming? What is it? Is there something that you really enjoyed doing as a kid that you all of a sudden started telling yourself that, you can't do as an adult? Why is that? Go back to those roots, go back to what you really enjoyed as a kid and find a way to make that come to life and really see, how that plays into your confidence, plays into your just positive, your well-being, everything. So it's trying to really understand the individual themselves and getting them to understand and see, maybe movement in a different light, right? Like we talked about, most people don't think about dance as a form of movement, but it's a beautiful form of movement, and it's healthy. It's fantastic. So it's really trying to, I guess, form those long-term strategies and align them with, some of those things people maybe enjoyed one time in their life or gave up, or maybe it's something that they wanted to do, but they never got involved in. But helping them find their way in movement and health to develop a strategy that is going to be something that they can sustain, right? Sustainability is huge in this whole conversation. So,
yeah, that is true. That's so a little bit of looking backwards in order to go forward, which is kind of nice. I like that idea.
Yeah, in some sense.
Eugene, what do you see down the road in terms of the future of the organizations that you're involved with, and some of the collaboration, some of the partnerships? What's your hope?
Well, as far as partnering, I have a lot of ideas, and implementing those ideas have, it's going to take. Tammy and can allude to this. We are a volunteer organization, and it's hard to get volunteers to do something. One of the hopes that we wanted to start, and I've been talking to our organization, but to Kim with UVA Health. But one of the things is, in the hospital, are you serving healthy foods to your patients and your employees? And, that's one of the things I find with a lot of people. They always complain about the food in the hospital. But are you serving healthy, nutritious foods in the hospital? And one of the things I wanted to work with them to partner with is, we have a lot of local small farmers here in the Culpepper community. And I wondered if maybe the hospital would partner with some of these small farmers and purchase healthy foods from them, which I think Chris said something about sustainability. But if we don't support the local small farmers, I think the pandemic let us know when the supermarkets ran out of eggs and milk and meat and all of that, it was a small farmer that got everything back together and got people fed again. And I think the small farmer and the local farmers are what's going to make this partnership work.
That's terrific. Tammy, what's your hope for down the road? How do you see the free clinic participating in a more deep relationship with the community?
I think we have some really good partnerships, and I'd like to keep growing them. I will say that the hospital has been amazing to our patients. They help with screenings, lab work, all of that, so that our patients don't have to pay for that, because frankly, they wouldn't go if they did have to. They just couldn't afford it. And so, that in itself is very preventative for our patients. We have such a great partnership with the Carver School and the minority and veterans farmers. And we've even connected some of our patients through a program that is working with Hispanic farmers to develop more, of them, encouraging that population to get involved with farming. So I think we're hoping to keep that going and grow it some more too, since a large population of our patients are Spanish-speaking individuals. I think there's lots of ways to keep people involved. We have some students through the school. We've had some of the participants at Options, a local youth program, who also help with the gardens. So I think that there's just lots of ways to keep going and think about all kinds of ways to be preventative and proactive. And, I think so much of health is expensive for our patients. I hate to say that, but healthy food is expensive for our patients. And, we have been able to get some of our patients in for some fitness programs that they might not be able to afford also. So, I think all of that, hopefully we can keep going forward with.
So you help mitigate some of the cost of food by having this remarkable garden. Are there other tactics you take to mitigate that very real problem of cost?
Yeah, there's we have there's a lot of good partnerships in Culpepper. There's a lot of good programs for food between the churches and the food bank, and so we try to make sure that they're aware of all of that as well. And one of our programs we're hoping to do next year is we have some gift cards for some of the grocery stores, and our nutritionist wants to take patients into the store and teach them how to shop healthier, kind of shopping around the outside of the store rather than the middle of the store where all the canned goods are and all the, saltier things. So that's something we had planned to do this year, but of course, COVID kind of limited a lot of that sort of outing programs. So that's something we're hoping to grow next year too.
Jim, what's your hope for down the road? What kind of a program or programs would you like to see to help mitigate these health risks?
Well, and cost should not be, a barrier to one's health and well-being. So I'm excited about, even just hearing more about some of the initiatives here with the partnerships and the opportunities that exist with the hospital and the health system, again, forming these partnerships with local farmers and, hosting and conducting free, PSA screenings in communities. And I'm just really excited about the opportunities on working more closely with each other to really bring these to our community and to neighborhoods that really, need it most. Looking forward to seeing the other side of this pandemic and, getting back to in person and being able to really provide these opportunities to our community. Because it's been challenging, the past year and a half in a virtual world, be able to really connect with our communities.
So we need to start to wrap up here. I want to ask all of our panelists, is there anything that you'd like to talk about that has not been mentioned, either as a unique partnership that has been established, either as something that you or your organization has done that has really made a difference that other people around the country and around the world should hear about and could perhaps replicate? I was always taught as a young nonprofit person that one of the key elements of a good nonprofit was that it was replicable. I'll ask you first, Eugene, since you started. We'll start to end with you first.
Well, I think one of the new initiatives that, and Tammy can allude to this, we just talked about this briefly, but as a pharmacist, we talked about a food prescription. And so when people, we want to do that. And so basically, and cost should not be a barrier to whatever, but, when a patient leaves the hospital and, Chris, he talks about exercise, and I never thought about dancing, but in the African-American, especially the elderly community, hand dancing is something that a lot of people like to do. And I think that's something we could get a lot of people to get exercise and make it fun. That's what we have to do. But I mean, it's we've got a lot of projects in this food prescription thing, and we want to be able to give a person a prescription when they leave and say, okay, we want you to eat healthy. I posted something on Facebook the other day that I got from one place, and it says, the question shouldn't be, why is eating healthy so expensive? The question should be, why is eating junk food so cheap? And I think, it comes down to dollars. And like I said, it's cheaper to eat junk food than it is to eat healthy. And Kim said something about removing the financial barrier to healthy lifestyles. And I think, like I said, I know UVA Health, and I can allude to that with the free clinic. They provide so much free screening, blood work, lab work, and all of that stuff. And that's something that I think we need to continue those partnerships with. But like I said, we've got a good group of people here. If we all work together, no man is an island. So if we all work together and everybody, works together, preventing, maintaining and doing that, I think it's going to be a good partnership, especially here in the Culpeper community.
Yeah, I agree. Tammy, is there a last thought you want to leave the audience with?
I would have to say that, in the beginning of me starting at the free clinic, of course, COVID kicked right in, and it limited so much of my ability to meet people and, only seeing people on Zoom or, but now I really think that, the more that I've been able to get out and meet people, this last couple of months at least, the Culpepper community is very supportive and has a huge heart. They love to give. They love to be a part of things. And, the more people I meet and the more connections we make, it allows you to really brainstorm and really come up with some great ideas. And so I feel very hopeful that, with that heart and with that, those connections, we can come up with lots of good new ideas, and that, we will find each other and grow in lots of ways.
Terrific. Yeah. Kim, do you have some final thoughts?
Just to echo and add on to what others have shared, just really, I truly believe that community is the solution. So as we engage with the community to understand what are we facing, what are our greatest needs, and involving each other in the solution, because we have vested interest in building a plan together, and recognizing that health starts in our families, in our schools, in our workplaces. So as we look at all of social determinants of health, it truly starts at an early age, and outside the walls of the hospitals. And so how we can work together really to address these root causes that influence health. I think we're going to see greater health outcomes if we really come together as a community and make investments and look at programs and initiatives that are addressing those root causes.
Yeah, it's an optimistic approach. Chris, final thoughts?
It's time to take action. This is a very, very crucial time, coming off of the situation that we all found ourselves in. And with a heightened level of awareness, people are more aware today than they were, several years ago. And it's becoming more important to people. And I think it's really just a matter of, providing those programs, the education, providing the opportunities for people to soak this stuff up, because there is this, higher level of sensitivity to the subject material, and people want to get healthier now more than ever, I believe. And if we can take advantage of this opportunity and not let it slide, it's going to be very, very important for the long term. And, just touching on some of the stuff that, we spoke about earlier, and, even Eugene, you mentioned dancing a second ago, and just to provide another example of, maybe going back to our roots, I've seen in areas where centers, community centers, or public works programs have walking basketball leagues. So rather than playing, basketball, jumping, running, it's just strictly walking. That's all you can do. You can't run. And, for our older population, obviously that's a little bit something that might be more enticing. And what a great way to get involved in movement again, get back to your roots, find fun. But yeah, it's about, finding those things. And it's important for us, as we talk on this panel, to take the action, right? We've got to create these opportunities. We've got to make things come to life. And we've got to, make people understand that they can trust us to provide those opportunities and provide sustainable programs that are going to help people long term.
Terrific. Well, I want to thank the founder of the organization Less Cancer, Bill Cousins, who is producing this show and allowed us to join together this morning to have this conversation. He's assisted by Laura Scharfenberg. And then we also worked closely with the Office of Continuing Medical Education at UVA with Wendy Seawack. And thank you to our panelists. This was informative, and I heard such great stuff going on in the Culpepper community, and it's a wonderful thing to hear the word hopeful. And I think I'd like to hope that that's how people walk away from this panel, is feeling a little more hopeful about community solutions. Thank you.